Well, Suzanne, it's great to catch up and talk a bit about modern strategy and leadership.
Very exciting to be here. Thanks for having me, Andrew.
It's great to see you, and it's been wonderful working with yourself, the board, some of the team, and some of your external partners and stakeholders in the open strategy process. And what I've noticed that, having the privilege of working with yourself and facilitating that part of that process, is I see different leaders, see different CEOs in our travels. And something that's really stood out from your leadership is having that real blend between EQ and having empathy, listening and willing to challenge your own assumptions, but then also being able to make those decisive decisions when needed. Mm-hmm. And that's sometimes pretty rare in leadership. Sometimes you get one or the other. I'd be really curious to hear a bit more. Have you worked on that as a leader, as a CEO? Have you learned of others? Do you actively lean into that balance?
It's very kind of you to say. Let me start with that. I think that in terms of leadership, it's something you're always working on. And again, it's something you build to over the course of your career. So you think about different times where you've had exceptional leaders and had the experience of learning and being mentored by them, but also times when you maybe haven't experienced such great leadership and what contributed to that, what you can learn from it. And there's always the fantasy about when it's your turn, when you'll actually become a leader or a CEO, how you might do that. And the fantasy is that it's always harder than you think it's going to be. You always imagine people will have the answers or the vision or the resources to do what you want to do. But I guess in my approach, engaging in reflective practice has been really important, staying centred in values. And some wisdom that was shared with me that I find really helpful is, in a CEO role, you're really paid to think critically and strategically, that it's not necessarily about subject matter expertise, but the ability to kind of survey the landscape, the prevailing winds, and then make a decision that's best for the organisation, informed by the expertise in the team. So try to bring my humanity to the role, as well as stay in that critical thinking and reflecting space, even though at times it's not always comfortable. Sometimes doing nothing is what's required. Other times you do need to make those actions, which can be tough decisions, but are in the interest of the organisation and the people that we're working with, and ultimately the mission we're trying to achieve.
Thank you for framing that in your own experience. When we look at strategy and leadership, in particularly strategy, you've recently gone through an open strategy process. You as a CEO, together with the board, decided you wanted to invest in that process. And I've heard a bit about, you wanting to involve perspectives both internally and externally. Can you tell us a bit more about your reasoning behind the decisions and even perhaps a bit of the process, how you found that?
Yeah, bit of an anecdote. You weren't our first choice, Andrew, but you persuaded me to the cause. Being new to the organisation, there's a level of comfort in working with people that you've worked with before and processes that you've experienced and understand. And so I didn't have that level of familiarity with the open strategy process, but what it persuaded me to think about, which has been incredibly helpful and helped us really zone in on our mission and how we're going to get there, is those external insights, is the ability to leverage the knowledge and passion of the team alongside the wisdom and goals of the board, and to come together in a single process. And it's set us up for success in the next 3 years. We feel aligned, we feel like we've got a clear pathway, we know what we want to do and how we do it, as well as our value to our sector partners. And so it's been incredibly helpful. So while not our first choice, it was the right choice and has landed us in an amazingly strong position in terms of what is a very busy sector within the mental health and not-for-profit sector.
Oh, that's wonderful to hear, and thank you for sharing that backstory, because it's great for ourselves and myself to learn as a consultant and a facilitator some of the reasons. So thank you for that. When we look at the process, opening up that strategy conversation, and we're seeing that, those leaders those executives that think that they still have to have all the answers, and that everyone's looking at them to say, tell us where we should go. We're seeing a bit of a shift, that it's those leaders who say, I don't have all the answers, I want to go and find these insights out together with yourselves, with our partners. Do you think leadership in pockets, or in larger pockets hopefully, is moving towards that direction and mindset?
I think it's mixed. I think there's still some pretty well entrenched positions in organisations, particularly bigger organisations, where that way of doing business is still prevalent. But certainly in the not-for-profit, in other spaces, the ability to think and move in different ways that are more agile and responsive to perhaps market trends, or, you know, in the complex system of workforce shortages, people are looking for different things in their workplace experience. So if you're not able to deliver that, you know, we've got 5 generations working for the first time in a single workplace. If you're not able to cater to those different journeys that people are on, then really workplace culture will suffer. So I see them as very much aligned ways of working, both from a culture perspective, but also setting us up for success within, you know, a commercial landscape.
Yeah, that's really interesting. You're talking about that 5 generations. There's a real kind of melting pot, isn't it, of ways of thinking, kind of belief systems in management and leadership. So that's, I think, acknowledging that in itself is really helpful.
Yeah. And the strengths of that, multi-layered approach, they're the communities we're trying to serve, they're our audience, and so embracing that perspectives better enables us to understand what our mission is.
Yeah, brilliant. And so on that, you know, the work you're doing as a leader as an organisation, Prevention United, can you tell us a bit more about that in terms of the prevention, the promotion, and really, you know, opening up those conversations as upstream as possible? Can you give us a bit of a snippet of the dynamics of that in perhaps a leadership and strategy context?
So fundamentally, we are an advocacy and knowledge translation organisation. So predominantly, the focus in mental health systems is on mental ill health. That's where the majority of budget and funding goes. But Prevention United was born out of a desire and a growing scientific literature that says we can actually prevent mental health conditions, and that with strategic investment, we can have a return on investment for individuals and families and all the people and communities that love and care for them, as well as the system costs and need for infrastructure and concerns that government has about increased rates of mental ill health within our communities. So from a strategy perspective, our goal really is to have people understand our message and invest in the cause of mental health promotion. So there's capability uplift within that, there's policy advice, there's research pieces that we do, but it's very easy to be righteous when you have a compelling mission.
Yes.
And in this process, and what Open Strategy allowed us to do, is actually say we don't just want to be right, we want to have impact. Like to be able to see our policy positions be adopted by government, to be able to track the increased proportion of spend on mental health promotion and prevention as a strategic target, helps us stay focused on that mission rather than internally focused on growth and development, that they sit hand in hand.
Yeah, I love the way you frame that. We don't want to be just right, we want to see what real impact we can have. Because I've observed you in both your leadership, how you're interacting with government, as we're fortunate as part of the process to engage with your government stakeholders, other providers, you know, more on that client's perspective. And I observed your open listening and even challenging the assumptions of the sector and even the organisations in a very, very healthy way. You don't always see that. Sometimes someone comes with a very single view and perhaps good intent that this is our vision, but not nimble enough to say, oh, this could be a bit different in this pocket of the sector, or this person could see it a bit differently. So I've observed that in your own leadership, but I've also observed that from an organisation point of view, you're adapting within reason, you know, and listening and different assumptions, which is really powerful. I think from a pitfalls point of view, either from a culture or leadership or a strategy point of view, is there any learnings that you've had, you've seen perhaps even from your past life or just broader, of other CEOs, you know, listening to this, any learnings that you've had across those areas that you could share?
So many, to pick just one or two, because I think, again, being willing to be on a process of continual growth and learning. to be able to inbuild time to reflect and check back in rather than just move on to the next thing, I think is a part of what I would consider a good practice of any leader, and part of what's required in a very complex and changing dynamic in the world that we currently live in. So in terms of wisdom I would share, I think having a pool of people around you that help you be accountable, that you can have safe but difficult conversations with is really critical. And I think back to one of our impact partners, Future Generation Global. They engage us to facilitate a range of that practice around our executive leadership group. And, you know, they're not distinct, the challenges that we experience as leaders: decision fatigue, complex demand tasks, you know, changing environments, funding pressure. But the ability to talk about them in a world that values illusory success requires some humility and some vulnerability. And for me, they're what I hope I bring to the leadership as well as what my strengths are. I think, again, having been in the mental health service system, and, you know, for me and many of my colleagues, absolutely working so hard to create system change, the willingness to change a point of view. You know, I really believed that if we designed better service systems, if we looked at user journeys, we would be able to improve the mental health and wellbeing of the Australian community. But that just hasn't been my experience. And so being willing to take that learning and apply that to a new sector, I think gives us a strategic advantage and allows the team to leverage new knowledge within what is a service system that we still very much need.
Yeah, that's so true. I really like how you raise humility there in leadership, because it is perhaps even 10 years, 20 years ago, that really wasn't even a conversation as such, was it? How that kind of frame of thinking fits within leadership. It was kind of, here's my way, you come in this direction. So I think that's really great to highlight. When we look at navigating change, and, you know, it's hard to have a conversation these days without mentioning it. Gen AI, one example. You know, it's the change is a moving target as such. As a leader, both from a strategy and cultural point of view, could you share some thinking? That's just one example of change. How you try to get a balance between adapting to change, but at the same time still sticking to that kind of clear direction overall. Is there any views or experience you could share in that light?
I think AI is a good example, and any leader who's not thinking about AI and what that means for their organisation is really missing a key strategic enabler and a key strategic risk. So if we look at the direction and the changing nature of work, what that will mean for availability of workforce and impacts on different sectors, as well as in the space we work in, the health and wellbeing outcomes. You know, that if we want to prevent mental ill health, we really need to focus on children and young people. And if their parents are grappling with redundancy or fears about what their future employment looks like, and we're talking about white collar jobs here of people who have significant technical skill, then their mental health is likely to suffer. And as a community, as we start to grapple with some of the fears and anxieties about what some of these technologies might mean, how we regulate those, we've seen that in the approach in Australia to the banning of children under 16 from social media, and how lacking in awareness the technology around that has been, and what the impact of that has been on the health and well-being of young people. So again, thinking about always risk and opportunity, and the ability to consider these as simply tools through which we achieve our mission rather than the mission themselves, and to come back to that word humility and collaboration, and transparently have those conversations both at a board level but also at a team level, so that we're in this together.
Yeah, that's brilliant. In terms of, I'll term it cross-sector insights, we're having a conversation with another CEO just recently, in the employment and disability space. And I know from that conversation there was a couple of big insights for myself and the other CEO because of that different perspective you brought. And we could say they were cross-sector, they weren't in the same traditional industry or sector. So I observed that firsthand by having a conversation, by deliberately kind of putting these best practiced industry rules aside and having a conversation about this is a problem we're collectively trying to solve. I observed from that conversation a number of really significant insights came from that because of those different perspectives. What's your thoughts on that? Do you think more of that, even within the mental health space, do you think we need more of that collective and even different thinking going forward?
Absolutely. Definitely an argument for different thinking beyond commissioning of services and programs to commissioning for impact and change. The reality is if we were running a commercial business on the outcomes of our mental health system at the moment, it's a very poor return on investment, and there's an argument to be made around chronic underinvestment over time, and that is a fair argument to be making, but also we're not seeing the returns that we would have wanted to see. And from our perspective, it really is not necessarily a failure of those systems, but the failure of a broader approach that sits across all systems to prioritise the health and wellbeing of children and young people in particular, but Australians more generally. So I think those cross-sector conversations that I really enjoy having, because I learn as much as the other person does, but is really, when we talk about whole of portfolio, whole of government approaches, that's what's required to solving problems in complex scenarios like AI, like health, like wellbeing. There's not many industries that don't overlap with another industry. So having sector insights is really critical to understanding the fullness of the problem and bringing all of our strategies and resources to creating a meaningful solution.
So true, and it was brilliant to see that firsthand, that observing that conversation between yourself and another CEO in perhaps a different or parallel industry. I saw that firsthand, which is brilliant. Just on collaboration, you run the Mental Health and Wellbeing Coalition, and what you're doing there and doing going forward is bringing that mix of providers, leaders into federal government and other governments. Can you just tell us a bit about your thinking around that and even how you've been able to do that? Because that's not an easy thing to do, and maybe just to share your experience in that engagement.
Yeah, so the Wellbeing and Prevention Coalition started out, I think, with 3 or 4 organisations, led by our founder, Dr. Stephen Carbone. And really the goal was to develop some consensus opinion and collaboration on what needed to change to move things upstream to focus on mental health promotion. We've now grown to 20 organisations, and it is the leading mental health organisations, research group, advocacy groups. And it's a challenge to chair because these organisations are a lot bigger than PU, and I guess our credibility in that space is the kind of research and sector knowledge, as well as the transparent way in which we partner, that values alignment, that mission alignment. And really the goal of bringing that coalition together is to create a clear consensus for government on where the priority areas for investment to really turn the tide on the growing rates of mental ill health in children and young people are. So for example, about 2 years ago, Prevention United led a really important piece of work around reimagining youth mental health. So what would a reformed system that focused equally on prevention and promotion as well as the treatment of mental ill health, what could that look like? The feedback from government was big, large-scale reform at that time was not on the agenda. And so more recently in this current election cycle, there was a far more pragmatic approach that said, okay, as a group of these 20 organisations, this is where we think you should start. These are the 3 things that we think you could invest in right now that would make a difference for the mental health and wellbeing of children and young people. And again, it helps, we hope, government really think clearly about what the issues might be and what a proposed solution could look like. They want to help, they want to invest in this space too, but sometimes aren't sure where to start. So by bringing those organisations together, recognising, there's some things that we might disagree on, but these are the things we all agree on, that's a far more powerful way to achieve impact.
I think, the bit I know about that, putting that group together in that collaborative way into government is a huge feat in itself. I know you want to do a lot more work and have a lot more impact, but that's a huge thing you've made that happen. So to round out from an impact perspective as well, because it's really important from what we're seeing from a consulting, even from an open strategy perspective, and from where the big societal problems to solve. as I know and I've learned from your own leadership and within the sector, having that impact mindset is really important, isn't it? To really start with what do we need to, where and what and for whom do we need to have impact? How are we going to measure that? How are we going to fund that? And I know you've given some examples for your future generation that's already off and running, which is brilliant. I'd love to just hear your kind of view both from a sector, how do you think we can look at impact, from an organisation, Prevention United, and then to finish on what impact do you personally, as a leader and as a person, in society, what sort of impact would you like to have in those kind of three different areas?
So really simple questions,
yes,
like really
yes,
easy.
Really, to finish, that's right.
Oh, look, if I start with the sector, I really think that we need to move away from activity funding, that funding programs and people. And, I've been a psychologist for 20 years. I've worked across all areas of health, so private hospital system, public hospital system, private sector. There are countless good stories out there of individual recovery, but at a population level, the story is getting worse. And so, again, we need to be thinking more globally about how we respond to that challenge. And I guess what my observation since coming into that role and into this role, I should say, and what we at Prevention United are really trying to do is understanding where funding for impact is coming from, recognising that in our sector, it's predominantly philanthropic organisations that are doing the heavy lifting, because they're able to have a greater risk appetite to say, okay, what programs could we scale up, what work needs to be done that then allows government to invest. But there's still some work to do around helping them understand what are programs and activity that does more than helps people feel good. So some of the things we're thinking about at Prevention United is how do we help facilitate that. So dedicating resource to some consulting around helping programs develop evaluation, thinking about how do we perhaps even employ a health economist to be able to talk to government about return on investment. I would strongly encourage them to take up their own treasury to do some of this work. Yes. But I think again, in these early stages of showing what's possible, the philanthropic impact investing space has shown a real appetite to be able to pilot some of these things that then hopefully will allow government to scale. So in terms of my leadership and my legacy, I guess if I've contributed to that in some small way, that will feel like a good day's work. If I'm leading a healthy, happy team that practices the kinds of things that we are wanting to see embedded at scale in other places, then again, I can rest very comfortably at night knowing that, in our own way, we've made that difference.
That's brilliant, and I've observed some of that personal impact, even the Mental Health Australia Forum. I was lucky to be out with yourself, seeing you engaging with your peers, with governments. When you see leaders, leaning into those very real, practical conversations, backed up with, data, I think that's hugely powerful, both from a sector, but also a personal leadership. So I thank you for that.
Very good for my ego, Andrew.
Well, no, and it needs to be called out when you observe it. So no, I thank you from the sector and from a leadership point of view. So it's been brilliant having a conversation. Really looking forward to seeing, the further impact that you as a leader and Prevention United are going to be having in the sector, and look forward to our next conversation.
Very much so. Thanks for your time, Andrew.
Thanks, Suzanne.